Today we will be addressing the effects of head injuries on development. From 1945 to 1999, there has been at least one football fatality resulting from a head injury in every year except for 1990. Fatal head injuries in this study included aneurysms, fractures, and subdural hematomas. Within this time span, there was a total of 712 fatal football injuries. A significant amount of injuries occurred at the high school level at 75%, while 6.9% of football fatalities occurred in college. Every year in high school, about 20% of players will get a concussion, which is an alteration in mental status usually accompanied with amnesia and confusion. Head injuries, including concussions, continue to be the leading cause of death in all sports, with the rate of concussions continuing to increase each year. Even if someone only suffers from a mild concussion, more serious brain injuries can occur. 75% of the head injuries occurred from 1945 to 1999 were subdural hematoma injuries, and if these injuries were combined with the brain fatalities in the study, more than 80% of the fatalities during this time could be due to these two causes. Second impact syndrome is where the brain swells after a head injury, usually a concussion, except that swelling is delayed. Definite cases of SIS include a medical review after the first incident, documenting the symptoms from the first impact to the second impact, witnessing a second impact, and neuroimaging the brain. Out of 17 cases looked at, no one exhibited a definite case. Therefore, this shows how it is very difficult to determine when someone actually has SIS. A case study concerning a football player who experienced two undocumented head injuries in a single game demonstrates the importance of knowledge of head injuries. The player was conscious after getting hit in the head twice, but then he started to get ill and had a seizure. This showed that even though someone may be conscious after a head injury, they could still be developing a serious brain injury. This also calls for the need for proper education concerning the prevention of head injuries for both coaches and the athletes themselves in order to stop traumatic outcomes from occurring after a head injury. A study was conducted over 13 years that compared the death rates of people who were in the hospital for head injuries, people in the hospital for non-head injuries, and people in a control group. Over the years, the people with the head injuries experienced the highest mortality rate at close to 40%, meaning that the death rate was increased after both mild and severe head injuries. The two studies presented show how head injuries significantly increase mortality rates. One way that people can prevent head injuries in sports is through the use of proper headwear. The Guardian cap has a special design that can reduce impact up to 33% compared to normal headwear, with the only difference being that the Guardian cap has a padded, soft layer on the outside of the helmet. The use of the helmets like these and proper education about head injuries can significantly decrease the number of fatalities from these types of injuries.